To my fellow chiropractors, today I want to talk about cookie cutter treatment plans. Please stop doing it. Please stop giving the exact same treatment to every single patient that walks in your office. Certain treatment plans are appropriate for certain patients, but they are not appropriate for others. I recently had a case that had 3 injured people in a car accident. It was a rear end accident. There was a 50-something-year-old adult, a young adult in their 20s, and a 6-year-old child. All 3 of these patients received the exact same treatment by this chiropractor. Now, the 50-something-year-old patient had, pain with radicular symptoms going into the extremities, had breakaway pain response on motor testing. They had a hyperesthesia in one of the extremities, so there was a lot going on with that patient. The 20-something-year-old patient had back and neck pain, no radicular symptoms, but they did have some positive orthopedic tests, some restricted ranges of motion with pain, right? So there's, some stuff going on there. The 6-year-old child's exam was normal outside of pain on motion. So neuro was normal, orthopedic testing was normal, balance was normal, range of motion was normal. It was just painful, right? But everything was normal in this child. Yet this child, the 6-year-old child, received the exact same treatment as the 50-something-year-old patient with the more complicated pain. And let me tell you, the treatment was 2 units of manual therapy, 2 units of therapeutic exercises, mechanical traction, unattended electrical stimulation, ultrasound, hydrotherapy, neuromuscular reeducation, therapeutic activities, shockwave treatment, and an unlisted modality they called neurobiomodulation. And I looked it up. It's with something called BioWave, and it's a percutaneous electrical stimulation, right? But it's another type of electrical stimulation. So this 6-year-old child got sometimes upwards of 10 to 12 modalities in addition to chiropractic adjustments. That is not appropriate care for a 6-year-old child with uncomplicated neck and low back pain. This child had nothing in their past medical history, no developmental delays, no physical delays, no anxiety, no depression, no ADHD, no neurodivergence, nothing. This child had pain on movement after getting into a car accident, and that's it. Ranges of everything was normal. And yet this child got all that treatment completely unreasonable, not related, not medically necessary. This child should have been given exercises, maybe 1 unit of exercises, 10 to 20 minutes, right? And some adjustments. I don't know many 6-year-olds, if any, that can tolerate manual therapy that would, give a therapeutic benefit, right? You can, rub them a little bit, right? But they're not going to tolerate true manual therapy, let alone for more than 20 minutes at a time. I mean, come on, guys, do better. I know we're in business, and I know businesses need to make money, but you can do it the right way and still make money. Do not give 6-year-old children 10 to 12 units of therapies with an essentially normal exam. I mean, just don't. Just stop it. Please just stop it. Give appropriate treatment for the patients that you have for the conditions that they're having. Okay? Please, enough of the cookie cutter stuff. It gives the rest of us a bad name when you do that. So please do better for your patients. Thanks.